So Victoria is back down to zero for the moment. The severe lockdown has been successful in achieving its aim. I'm joined now by Professor Michael Toole, an epidemiologist at the Burnet Institute in Melbourne. Michael Toole, welcome. So as a Melbourne resident, how has it felt seeing those 2 days of zero now cases over the past 48 hours?
Well, good morning, Joe. It's an enormous relief. It's been a very long winter in Melbourne. Around about 10, I went round to my local bakery to buy some donuts, but of course they'd all sold out.
Too late. Okay, so how does the Victorian lockdown compare to other lockdowns around the world in relation to its severity, its duration, and its success in suppressing the virus?
Well, in terms of duration, it is indeed one of the longest lockdowns in the world, but there have been longer ones, all in Latin America. So Santiago, Lima in Peru, La Paz in Bolivia, and Buenos Aires in the Argentines have all had longer lockdowns. And Bolivia had a much stricter lockdown so that you couldn't, only one member of the family could go shopping once a week. In terms of its success, yes, it's up there with, I think, only 5 other countries that have emerged from their second waves in the way that Victoria or Australia has.
So would you regard this as one of the most effective lockdowns the world has seen through this pandemic?
Yes, I'm excluding New Zealand at the moment because they had a stricter lockdown during their first wave. And they didn't really develop a second wave. They did very well as a result of those clusters in Auckland to prevent a second wave. So I've looked elsewhere where second waves were very substantial. And I can only see countries in Asia that are comparable. And they are Vietnam, very, very effective, Hong Kong, Singapore, Japan and South Korea. And of those, Japan is still reporting hundreds of cases a day, South Korea about 50. So really, Hong Kong and Vietnam are the only 2 countries I can find in the world that are comparable to Victoria.
And what do you think explains the effectiveness of what's happened in Victoria?
Well, I think it's, at the Burnet Institute, we've done some retrospective analyses, and there's been sort of, since July, 3 sharp bends in the roadway out. And the first one was after stage 3 was introduced. The next sharp bend was after masks were mandated. And the third one was after stage 4 and the curfew. Now, those other countries I mentioned in Asia did not have national lockdowns, except Vietnam had just a 2-week lockdown. I think they've succeeded because of the very high level of listening to and obeying public health directives, and of course mask wearing, which is a culture in those countries. Very effective contact tracing and just localised restrictions. So a lockdown is not an all or nothing option, but you do need those conditions that I just mentioned to not have a lockdown.
So will other countries be using this Victorian model now?
Ireland already is. So Ireland announced a national lockdown earlier this week or late last week. And if you look at their restrictions, they're almost identical to Victoria, except they don't have a curfew. And other countries will be looking our way. I think we will be the envy of the world as we enter a summer of extremely low community transmission. But we still have to be very vigilant. Just look at what happened in Europe during their summer. We cannot follow the example of Europe or, say, Israel in relaxing restrictions too much during the summer.
Yeah, the Chief Health Officer, Brett Sutton, just said in that media conference that complacency is the biggest challenge now. And would you be very supportive of masks continuing to be mandatory for some time?
Yes, definitely. I mean, masks are now a no-brainer. Early on, we weren't sure how effective they were, but now we're absolutely certain. Say, according to a study just published from Canada, they contributed mandating masks to 25% of the decrease in transmission during the first wave. Now, it's cheap, it's affordable, it's not that difficult. You know, I'm used to it. Most people I know are used to wearing masks now in Melbourne. And, of course, it doesn't disrupt the economy. So I think, yes.
And what do you make of the easing of restrictions set out so far happening from midnight tonight? Is it striking the right balance or not? And further restrictions coming into effect from November the 9th?
Yeah, I think it has struck the right balance. And the main comment I would make is about the limit of 2 people visiting another household. That's a critical one, and that's the one we have to watch. Because way back in June, we eased the restrictions from 5 people allowed to visit a household to 20. And that's what really fueled the second wave. You know, I'm not going to comment on the quarantine leak, but Sydney also had a quarantine leak, but they didn't have that enormous chain of transmission that we had back in June. And it was mainly through family gatherings, and they were mostly legal family gatherings.
Yeah, really interesting to hear that. Yeah, so we just heard in that media conference then they set out the home visit rules from tonight, and it's 2 adults and their kids over at one house, and that one house can only accept those people in that 24-hour period as well. So that is critical.
Yes, I think it's great for me. I'm already in a social bubble with my sister, but now I can have my upstairs neighbours down for dinner.
Okay, so how much confidence do you have now in Victorian health authorities' ability to keep on top of this? Because inevitably there will be outbreaks pop up now. There have been questions raised over the effectiveness of what was happening in Victoria before. Do you think those questions about the system set up before were legitimate and valid? And what do you think about the ability of that system now?
Well, I think at the height of the second wave, when we were reporting more than 500 cases every day, it was impossible to do the kind of comprehensive and rapid contact tracing that they are doing now. That's the public health team at the Victorian Public Health Ministry. Sydney has been able to do a lot more thorough contact tracing because they've had low numbers. And Melbourne or Victoria is now doing exactly the same kind of contact tracing as New South Wales. And that includes what I call backward contact tracing, or what Victoria calls upstream. It means looking for contacts of cases before they develop symptoms, not just after. And that often reveals, as it has in Sydney a couple of times, an unidentified case who was the actual start of that cluster. So I think they've done a great job in the northern suburbs, in Kilmore and Shepparton, and I have a lot more confidence now for the coming weeks and months.
Okay, Michael, Toole, really interesting to have a chat with you this morning, and enjoy that dinner with your upstairs neighbour when that happens in the coming days.
Okay, thanks, Joe.